results show that there's a social return to education, which is almost as big as a private return to education. That's why the government needs to subsidize it. So these kinds of government expenditures are really necessary for future growth, for the private sector to kind of develop that kind of economic engine, which normally comes in terms of expansion. It's the private sector that's going to grow the economy, but the foundation in terms of R&D, education, and infrastructure has to be there.
Yeah, how good is the government in thinking long term? The private sector has not saddled us with a single program like Social Security that has $75 trillion of unfunded long-term, $8 trillion in unfunded long-term liabilities over the next 75 years. The prescription drug program, started only in the last administration, is now $9 trillion in the red in terms of unfunded long-term liabilities. And on down the list. So I'm not sure where you're coming from to suggest the government is the long-term thinker. It's the long-term saddler of massive debts that will have to be paid for out of the productivity of the private sector.
There are a lot of businesses who can't seem to think beyond the end of the next quarter, actually, and that's part of what got us into trouble we're in with the financial sector.
But they go broke though. We're not there for the next 75 years getting ever higher taxes from us.
But one thing I would say, I agree with Harry on the fact that at a certain point, monetary policy doesn't work, and we're at that point now. It isn't that we're rejecting fiscal policy. What we're saying there's a different fiscal policy, and that fiscal policy is fiscal policy of lowering cost of business which stimulates. That's the difference, I think. Well, I think both of us agree on fiscal policy is the way to go.
That raises another question, though. You said that the fastest way to restore business is to cut costs. Well, if you cut costs and you don't have any customers, how does that restore your business?
Because prices come down. You become price competitive and prices come down. There's nothing that generates customers like lower prices.
I mean, essentially you shut the supply curve to the right.
In other words,
and prices will fall and quantity will go up.
Yeah.
I would be in favor of cutting costs. I think it's very important to cut costs, to have targeted tax cuts for investment.
Yeah.
And to talk about cutting costs, one of the biggest costs right now in American business is healthcare. I mean, in small businesses, people can't get insured because the cost of insurance is so high.
Sure. But you know, the interesting thing is talking about cutting costs is the one area of medicine that has been consistent with inflation is cosmetic surgery. And the reason is there's no third-party payer. So I think the more intelligent way to cut costs in medicine would be this plan where they have the health, like a health IRA plan, and then allowing competition across state borders in insurance. Because as soon as you let the insurance companies compete, so I can buy insurance, say in Texas, or I can buy insurance in Illinois, where it would be cheaper. When you introduce competition, I don't think the government stepping in will do it, because most experiences with government companies cost drugs.
We can debate healthcare, but
Yeah.
the issue about health reform is that about 20 to 30% of the expenditure in the health sector, in the private sector, is on gatekeeping costs. That means they hire a slew of people to try to prevent persons from getting insured by excluding them and trying to deny them different kinds of stuff. So there are different estimates, but 20 to 30% of the expenditure in the private industry on healthcare is these kind of gatekeeping costs, which are completely wasted, and which could actually be actually used to provide services to the general public.
But we have to come back to why the healthcare costs look the way they do. And my argument would be, if you look back to World War II, where we started wage and price controls, the private sector responded to that and said, well, how can we get around these wage and price controls? I can provide health insurance. We have 70% marginal tax rates, which say, if I give you $1 worth of health care, you get $1 worth of health care. If I give you $1 and you go out and buy it yourself, you only have 30 cents to do that. Then in 1951, the IRS says, oh no, that's taxable income. Congress responds and says, oh no, we're not going to make that taxable. I mean, there's absolutely no reason when you go and get a job that you expect them to give you health care, but you don't expect them to give you car insurance. You don't expect them to give you life insurance or homeowners insurance. What's magic about health insurance? The magic about health insurance is it's heavily regulated by state and federal government, and it's the same thing. The government drove us into the ditch in healthcare, and the response has been, as Bob Hicks says in Crisis and Leviathan, the response is, let's let government do more of it. Right now, total expenditures on healthcare, 49% of it, government spent through Medicare, Medicaid, and public employee healthcare programs. If we think that we're going to bring healthcare costs down by having the government spend 100% of the expenditures on healthcare, we're just nuts.
Well, it would bring business costs down. I mean, why do you hire retirees? Well, you hire retirees instead of young people because their health costs are subsidized by the government and they're on Social Security. So you're getting a good deal with the elderly folks that you're not getting.
No question it might bring the cost to me, Ford Motor Company, down. But it doesn't make it less expensive to make health care. It doesn't bring, and how am I going to pay for that? Well, we all would like to have someone else pay for our health care, right? I mean, I just soon have the government pay for my health care as well. But as Larry pointed out, in the end, they got to get the resources from somewhere, and it's not, and despite what one of our speakers said last night, you know, it doesn't come from heaven, it comes from Washington. Well, how does it get to Washington? Out of your pocket.
But what's magical, you asked what's magical about healthcare. What's magical about healthcare is that we don't believe that it's morally right to deny healthcare to people because they can't afford it.
But why is it that the employer provides
basis on which we have a problem? Because that means that if somebody can't afford it and gets healthcare, the rest of us pay anyhow.
What
We
is
have to
the
organize
why
this
is
intelligently.
Because it helps out with adverse selection moral hazard problems. You have a pool in your employment, you have a pool of people, and they're not going to self-select in or out. If you have to go buy health insurance on your own, then they're going to try to, they can't screen out good candidates from bad candidates. They're going to have to set an average premium. And if I look at that average premium, I'm relatively healthy, I'm going to opt out and say, I'm not going to pay for health insurance. It's too high because I'm a healthy person. So what happens, you're left with just the sick people, and then the insurance companies aren't stupid. They're going to say, well, the sick people have higher costs, we're going to raise the premiums there, and you get this split premium. So this are split, you get this non-equilibrium where you get healthy people won't be able to buy insurance because it's too expensive.
So we talk about Medicare. The very little secret about Medicare is that the administrative cost in Medicare is very low because the criteria is very simple. Once you're above 65, you get health care. And again, the site has not responded to the issue that in private insurance, about 30%, 20 to 30% of the cost of running their insurance company is basically gatekeeping costs, which are a dead weight loss. They don't give benefit to anybody, except they create adverse selection in the sense that if you have a pre-existing condition and you're working in a small business, you are out of luck. You can't get insurance. Even the employer can't buy the insurance because it's just too expensive to insure 20 or 50 persons if one or two of them have a long-term disease. So the problem is that you have to have a large pool, and every individual should have the right to buy insurance. And I agree that they should pay deductibles. They shouldn't demand too much services. So they should bear a large portion of that expenditure. But every American needs to have the right to buy insurance in a large pool so that the cost can go down. If you're just negotiating by yourself, and if you have a pre-existing condition, you're just out of luck. And it's immoral, I think, to put people out in the cold just because they have a pre-existing condition.
I think the problem you cite would go a long way to be alleviated if we, as either Gary or Harry have already mentioned, if we allowed people to purchase health insurance across state lines, which we currently don't, and if state governments got out of the business of piling on unfunded health benefit mandates. In state after state, you've got, here in Michigan, we've got dozens of requirements on insurance companies. If you want to sell insurance here, you have to include coverage for, fill in the blank, and every year it's a debate over a half a dozen new ones. All of these cost money, and as much as 25% of the uninsured in this country don't have insurance because they can't afford, or their employer can't afford, the high cost of state-mandated health benefits. If I don't want coverage for drug abuse treatments because I don't use drugs and don't plan to, I shouldn't be forced to buy it. Or hair transplants in Minnesota, believe it or not, is required.
Okay, well, we need to get back to the depression talk as opposed to the health talk. I have the unenviable position of being able to stand between these people. We're going to take a quick 5 minutes here for those of you who have to take off to work and classes, and then we're going to go through the questions.